So my hands are cold.
All right, Monica, this is for the abdomen and thorax competency or eval. And yeah, so I'll start with ABCs, checking for airway, breathing, circulation. Take a past and present history, checking for also unusual sounds, pneumothorax, for any crepitus or sucking, and unusual sensations for like breathing problems. I will inspect for any swelling, discoloration, deformity, abdominal breathing patterns, deviated trachea, pneumothorax, hemotysis or hematuria. I'll inspect the breast for any contusion, and then nipples for any heat rash. And then so for palpations, bony palpations, checking for both fractures and luxations, I will palpate the clavicle, the shaft, the sternoclavicular joint, and the acromioclavicular joint. For fractures, sprain, luxation, the sternum, the manubrium, body, and xiphoid process, all for fracture. The ribs the bodies of the ribs, the costochondral joints, and the costosternal joints for fracture and luxations. The flip on your back or on your stomach. I just realized the pretty much this section, but your thoracic vertebrae or vertebra. For the costovertebral joints for any luxations. Next would be soft tissue palpations for any strains. So flip over again. And then I'll palpate the pectoralis major, the intercostal muscles again, which are the muscles in between your ribs, the rectus abdominis, the internal and external obliques, the abdominal quadrant. So you have his upper left, upper right, lower right. Let's see what else. Oh, and the breast for contusions. Obviously, be wary if it's a female. Next would be special tests. So special tests. The first one is abdominal rebound pain test for checking for any internal organ damage. So I'll basically compress and then let go. And if there's any pain during that rebound, then that's a positive test. Meaning there could be signs, or that shows signs of there could be potential internal organ damage. Rib compression test. I feel like this one I have to like actually put my phone down. Hold on. So rib compression test. So compress the ribs. Test for fracture, and then you have the force inhalation and expiration test. So the force inhalation is gonna test for external intercostal strain. So yeah, breathe in as much as you possibly can. Okay, relax. And if there's pain there, then potential sign for a external intercostal strain. So now do forced expiration. So breathe out as much as you can. Nice. That's testing for internal intercostal strains. And then Kerr-sign, which is for your spleen, and then McBurney's point, which is for the which is basically your appendicitis. Then for range of motion tests, I would test them all both actively and passively. In this case, I'll have you do it actively. So trunk flexion. Alrighty, and then relax. So, and then you're gonna have to turn on your And so then this one's gonna be trunk extension. Nice. And then you have lateral flexion, and you'd also do on the side, and rotation would be the last one, so you can like crunch up and rotate. And there, yep. And then for this, so crunch up just a little bit, and then like rotate, like okay, cool. Like your shoulders, okay, cool. And so that's that. So for then the muscular strength test. I feel like dang, you kind of, I gotta post it up. Hold on. Okay. Alrighty, here you go. So trunk rotation. So if you go up, and then you're gonna rotate against like my hand, basically. Go. Alrighty, relax, and then go this way. All right, nice, relax. So that was trunk rotation for checking for the rectus abdominis, internal and external obliques. And so trunk flexion. So then kind of just like go against me. Yep. So regular trunk flexion is just rectus abdominis, internal and external obliques, and the transverse abdominis also. So then we can also do for the erector spine a trunk extension. Yeah, sorry. Alrighty. And go up. And if you need to, you can apply a little bit of pressure. Alrighty, relax. And then lateral flexion. So, alrighty, go against me. Alright. And then I also do it on this other side. I won't make you do it. Yeah, she gets the point. Lateral flexion for the ipsilateral flexors, extensors, and the ipsilateral quadratus lumborum. And also the respiratory muscles are the intercostals and the diaphragm. And so for neurological tests, motor would be Beaver sign. So we would observe his, we'd lift the shirt up and be able to see their belly button, and then I'll have you do a crunch. And if the umbilicus moves up towards the head, it's a sign of like nerve damage or possible neuromuscular dysfunction. Then, so that's Beaver sign. And then, what was I going to do? Oh yeah, I was going to do this. So then, for sensory, you have T1, which is at the armpit. T2 and T3, which is between T1 and T4. T4 is at the nipple line, so then T2 and 3 are between 1 and 4. T5 is between T4 and T6, and T6 is your xiphoid process. And then T7 and T7 and T9 is between T6 and T10, because T10 is at the navel. T11 is between T10 and T12, and T12 is at the pubis, which is above the inguinal ligament. And then I would end with blood flow test by taking blood pressure.